our transportation sector is a leading domestic source of carbon pollution driving climate change. Cleaner cars can dramatically cut air pollution that is driving climate change, avert the most catastrophic impacts of the climate crisis, and address longstanding environmental injustice. Air pollution is a key contributor to a growing number of chronic respiratory conditions that we are seeing in our state. And to reiterate, because these vital statistics are, they're people, they're not just numbers. In Wisconsin alone, approximately 75,000 children and 468,000 adults suffer from asthma. As a mother, this is no longer a statistic, but a daily reality. After months of suffering from bouts of chest tightness and pain, shortness of breath, and multiple trips to primary care, behavioral medicine, cardiology, and pulmonology, my very active and health-conscious 14-year-old was diagnosed with asthma. She now relies on the daily use of albuterol and steroid inhalers to treat her condition and is limited in her ability to engage in certain activities with her peers. She lives with a daily anxiety that a growing number of our children should not have to experience. I also wear the hats of occupational therapist and rehabilitation services manager and green team leader in home care. Many of the patients we serve live in low-income communities and communities of color who are and will increasingly be impacted by the most by air pollution and the climate crisis. By investing in cleaner cars, we would reduce harmful pollution and ensure our most vulnerable communities in Wisconsin have cleaner air. As a home care provider, asthma, pneumonia, and chronic obstructive pulmonary disease are diseases that regularly plague the patients we serve and are often the reason they are no longer able to live safely and independently in their own homes. A move to an assisted living facility or nursing home facility is an expensive choice for those whose finances are already strained by forced early retirement due to disability and compounding medical bills. For those determined to remain in their own homes, dependent on oxygen, a power outage caused by the increasing prevalence of storms can be a serious threat to their health, and in some cases can threaten their very survival. Our occupational therapists and physical therapists and speech therapists care for pediatric patients as well. Compared to non-Hispanic white children, Latino children are twice as likely to die from asthma, and our Black youth are 10 times more likely to die from asthma than non-Hispanic white youth. If our planet continues to warm to 2 degrees Celsius, Black communities are 40% more likely than other groups to live in places where extreme temperatures will cause more deaths. Ignoring carbon pollution from vehicles only exacerbates the environmental injustices facing communities that have disproportionately borne the greatest impacts from tailpipe pollution. We call on the Environmental Protection Agency and the Biden administration to set the strongest possible vehicle pollution standards for all automobiles and light-duty trucks produced from 2027 and beyond. We want these standards introduced this March, as they will help reduce fossil fuel use and strengthen our energy and national security while also saving consumers money at the pump.